Hello everybody, welcome to number 1 Doctor channel. Today we will talk about fistula and ano. Definitions. A fistula is an abnormal communication between two epithelial surfaces, for example between the hollow viscus and the surface of the body or between two hollow viscera. A sinus is a granulating tract leading from a source of infection to a surface. Etiology. The term fistula and ano is loosely applied to both fistulas and sinuses in relation to the anal canal. The great majority result from an initial abscess forming in one of the anal glands that pass from the submucosa of the anal canal to open within its lumen. Growth of bowel organisms, as opposed to skin flora, from an anorectal abscess is suggestive of the presence of a fistula. Rarely, fistulas are associated with Crohn's disease, ulcerative colitis and carcinoma of the rectum. Occasionally, also, tuberculosis. Anatomical classification. Anal fistulas are classified according to their position in relation to the internal and external anal sphincters. Submucous, subcutaneous. Superficial, intersphincteric, transsphincteric. Low anal, suprasphincteric. High anal, anorectal, extrasphincteric. Superficial fistulas may be either subcutaneous or submucous, and are superficial tracts resulting from rupture, respectively, of subcutaneous and submucous abscesses. Intersphincteric and transsphincteric fistulas are examples of low anal fistulas, in which the tract is below the anorectal ring. They constitute 95% of all fistulas. They differ in their penetration through the external sphincter, and most are at a low level with the tract passing through the subcutaneous part of the sphincter. Suprasphincteric fistulas pass via the intersphincteric space to open into the anus above the pulmorectalis, and are high anal fistulas. Anorectal fistulas, fortunately rare, extend through levator ani to open above the anorectal junction. Fistulas with external openings posterior to the meridian in the lithotomy position usually open in the midline of the anus, whereas those with interior external openings usually open directly into the anus. Goodsell's law. Clinical features. There is usually a story of an initial anorectal abscess, which discharges. Following this, there are recurrent episodes of perianal infection with persistent discharge of pus. Examination reveals the external opening of a fistula. The internal opening may be felt per rectum, but probing of the tract is painful and should be deferred until the patient is anesthetized. Accurate assessment of the extent of the fistula tract, in particular its relation to the anal sphincter, is crucial. Where doubt exists, abdominal ultrasound or magnetic resonance can demonstrate the anatomy of a fistula very clearly. Treatment. Superficial and low-level anal fistulas are laid open and allowed to heal by granulation. Because no sphincter, or only the subcutaneous part of the external and internal sphincters, is divided in this procedure, there is no loss of anal continence. Fistulas can only be treated in this manner when they quite definitely lie below the level of the anorectal ring. Careful assessment is therefore important. In high fistulas, suprasphincteric, and transsphincteric close to the anorectal ring, the fistula tract is either injected with fibrin glue or a bioprosthetic fistula plug is passed along the tract. If either of these sphincter-preserving treatments fails, the lower part of the tract is laid open and a non-absorbable strong ligature, like nylon, termed aceton, is passed through the upper part of the tract and left in place for 2 to 3 weeks so that the sphincter is fixed by scar tissue. The tract is then divided by repeated tightening of the ligature. Laying open of the whole tract of a suprasphincteric fistula in error will completely divide the sphincters and result in incontinence. Recurrent fistulas that are associated with Crohn's disease may respond to long-term antibiotics and treatment with an anti-tumor necrosis factor antibody such as infliximab. Thanks for watching. Please like and share our videos and subscribe to our YouTube channel number 1 Doctor. With my best wishes. Dr. 8 Fomid.